Hello, this is Jay from Brain and Neuroplasticity. On March 10th, 2018, we'll be discussing headaches and the various mechanisms that can be involved. And looking from a functional neurologic standpoint, if we would look at the brain and see how it communicates to the brain stem, which controls your vital centers, we realize that the brain does 10% of its output to the activating centers to keep you alive. So these are your vital centers, and these ones will then pass their information down to the spinal cord, and what they'll do, I'll say this will excite the areas down to the cord, especially these areas in here, which we'll refer to as the intermediolateral cell nucleus. This is basically the primary nucleus of your sympathetic system. So in order to keep you alive, the brain needs 10% of its output here to keep the system active and to secure the blood supply through the IML. Now, realizing that when you look at brain and you look at its output from the medullary centers to here, these medullary centers, this accounts for about 90% of the brain's output, and these ones are the inhibitory centers, meaning that these centers pass their information down to the cord, and these will then inhibit this same system, meaning that it's going to inhibit this IML. Now, what we see functionally is that when you look at the different brain centers, if you would say this is the left side of your brain and this is the right side of your brain, if you were to have a physiologic difference of a less functioning right-sided brain, you're going to lose 90% of the input to this lower brainstem area, or you're going to lose some of that, whereas effectively on the ipsilateral side, you're going to then further lose this inhibition of the IML, and resulting that your sympathetic system is going to be in overdrive. You're going to get more activation of the sympathetic system, meaning a higher blood pressure, a higher cardiac output, and also vasoconstriction. Because of these changes in blood pressure, this can result in a concomitant change in blood flow to the brain areas, which can result in headaches. So oftentimes we must identify which side of the brain is working aberrantly, and chiropractically we can use the spine by looking for example, movement parameters that might be not as efficient, or to say subluxations, where we then adjust, for example, from the left-hand side, and by adjusting from the left-hand side here, we're then able to activate centers that will augment the function on the opposite side. So adjusting from the left side tends to more activate these right side areas. If we then increase the right side brain areas, that's going to create more inhibition to the IML and then decrease the blood pressure in those veins and arteries. So that's the way that we functionally look at it, and we're going to explain more about the mechanisms of how you can chiropractically address these issues, and we're also going to be including the nutrition as well.